Elderly people are not coming to the party when it comes to the vaccine rollout. Could it be hesitancy or a lack of access to technology? Well, either way, Acting Health Minister Mmaloko Kubayi-Ngubeni says it's concerning. The elderly are being vaccinated in phase 2 of the rollout program. For more on this, we're joined by eNCA reporter Heidi Giokos. Heidi, you've been speaking to Momentum, and they, for instance, have 4 private sites. What have they been saying about the turnout there for over 60s?
Yes, and I think this is a very interesting aspect that we're picking up, given the fact that the Acting Health Minister yesterday indicated that there is concern over the turnout for those 60 and above. But Momentum is a private site, like many other sites in the country, trying to assist governments in the vaccine rollouts, and they have picked up that just in the last week they have seen a drop of about 25% of those 60 and above coming to get their COVID-19 vaccine. So they are also picking up this big concern that was mentioned by the Acting Health Minister to say we're not entirely sure what could be contributing to this, but this is an alarm that we need to figure out what is causing this. What's interesting is that they have 4 private sites across the country, 2 in Gauteng, 1 in KZN, and I think the other one is in the Western Cape, but they are seeing a significant drop. So even the private sites are picking this up, and in a recent article we've also seen that Dis-Chem has seen about 75% drop in the actual appointment schedules of those 60 and above. So it seems as though this is happening across the board, and many are saying it could be because the majority have received their first dose and they're waiting for their second dose. But that's not entirely the case, because we know that it's 5.5 million that need to be vaccinated in the 60 and above category, and we haven't even reached 2 million in that particular category. So it's a bit of a concern, but government says they're trying to address it.
Now, talking about those who have medical aid, for instance, they are being assisted by the private health sector, right? But those who don't have medical aid don't seem to be assisted by the private sector. Could this be a contributing factor to the low turnout?
Most certainly, Masego, and it's a very important point to touch on, because initially government had explained that if you don't have medical aid, it is not a problem and that you will be assisted. Nobody should be paying for the COVID-19 vaccine. That message had been communicated time and time again. But it seems as though the private healthcare, and what we've gotten from Momentum, is the fact that they were told by government to not assist those who have walked in that don't have medical aid unless you are 80 and above. Dis-Chem, which also has private vaccination sites, indicated the very same thing. But we know that private sites have been told only if you're 18 and above you can be assisted, but they aren't seeing many walk-ins. So they're saying it could contribute to the fact that many people don't know if they can actually go to private sites. The message is not clear as to what they need to do if they are 60 and above and they don't have medical aid, or they do. So it could possibly be a contributing factor.
So the next few weeks are going to be very important. More sites opening up, more people getting the jab. Now we've got the teachers also being part of the rollout. How important is it that government and the private sector works together now?
It is extremely important that they need to hold hands, and okay, not physically because we shouldn't be touching each other, but they need to get together and truly get this vaccine rollout ramped up. We know that 50 and above can start registering as of the 1st of July, and we know that vaccines will begin from the 15th of July for those 50 and above. We know workspaces are also going to start getting vaccinated, educators, law enforcement officers. So we're going to see an extensive ramp up of the vaccine rollouts. And we have seen time and time again, Masego, that government does not have the capacity to do this on their own. And this is possibly the biggest vaccination rollout that the country has ever undergone. And now is the time where they need to work together. So Momentum is saying they're willing, but they don't have as many vaccines as they would have liked to increase vaccines administered per day. So hopefully somebody in government is listening to this, and we will get more work done with the private sector to get more vaccination sites and more vaccines administered.